Okay, one of the things we already mentioned and is very important to mention again is the positive impacts of exposure to green spaces and nature on human well-being and health. So health is a physical thing, mental health of course also included in that. Well-being is a more esoteric term. It's people's perception of how they are dealing with stresses, how they are able to cope with adversity and so on and so forth. So well-being is a quality of life thing. Anything you do, it's a non-market good, so putting value on it is always difficult. So that's similar to biodiversity, ecosystem services, and health benefits, including mental health and well-being. So we discussed this briefly. So we're looking at a city here in the background, the high rises, and in the foreground you have some kids enjoying nature, lots of greenery, people enjoying physical activities, family time together, bicycling around, elderly people sitting around chatting. 3 cups of tea per day is always great with friends. You can see here younger people enjoying time together as well. So what are the various designs and limitations relevant to navigating the evidence of health outcomes of green spaces in cities or nature-based solutions we have been discussing? So we are looking here at evidence type, key characteristics, key limitations to consider within evidence linking NBS to health. So every time you invest money in something like nature-based solutions, you want to measure benefits in terms of these outcomes, and there are always limitations to those, including measuring things like well-being, right? Systematic review, so again a meta study of various literature. Key characteristics: comprehensive and transparent search strategy often includes analysis to guide interpretation, such as insight into risk bias, how people feel about the impacts of NBS on health in this case. So what evidences they think is there for that. Key limitations to consider within this: publication bias in the underlying literature may lead to omission of unexpected or null findings. So you are kind of facing a street lamp syndrome, where you look for the story of a drunken man searching for keys under the street lamp because that's where the light is, even though key was lost in the dark space over there. So when you start to look for things, you begin to find them. So that can lead to omission of unexpected or null findings, that maybe there was no impact, positive or negative. Meta-analysis, quantitative combination of findings across studies, typically conducted among the studies identified in the course of a systematic review. So here, heterogeneity of measurement and analysis methods across studies make meta-analysis less common and interpretation challenging. Okay, so it means you are not specifically looking at a set of studies that set out to find the impact of NBS on health outcomes in cities, but you take all the studies that are related and try to extract the information that relates to NBS for cities and for health outcomes. So that can have a limitation. Cross-sectional studies, data collection from one point in time, so NBS exposure and health outcome measured at the same time becomes very important. Association can be distorted by confounding bias, by having data on a simple, not representative of a sample, not representative of the larger population, i.e. a selection bias happens. By recalling exposure incorrectly based on outcome status or poor recall, so that is a recall bias, or by reverse causality, measured outcome actually causes exposure. Okay. Longitudinal study. Data collection occurs over time, often monitoring changes in health for a fixed set of individuals. It's called a cohort study as well. This facilitates distinguishing whether NBS was experienced prior to health outcome changes or after. So associations be distorted by confounding bias or selection bias. Okay, keep all that in mind, especially for studying non-market goods like well-being. Randomized controlled trial studies, on the other hand, allocation to groups with and without NBS happens, but by chance, creating balanced groups and evidence less susceptible to confounding bias. So you do randomized controlled trial in this sense. The key caveats: standardization of NBS and inclusion criteria may limit opportunities to explore the effect of modifications or differences in the strength or direction of association by NBS type or population group. So same NBS in a city with different socioeconomic groups, the benefits, evidence for this, and so on may be different. Natural experiment allocation to groups that differ in contact with nature is determined by events that are otherwise unrelated to individual health, approximating the advantages of a randomized control trial. So here vegetation loss or other sudden change may not be perfectly aligned with the timeline and engagement surrounding a corresponding NBS proposal, for example, tree loss versus planting. Anyway, these are details we should just keep in mind. What are the common measures of nature contact with health studies? I won't read in such detail, but you have outdoor greenness or health vegetation, outdoor green spaces and green land cover, and you have contact with nature. So example measures for it could be density or average amount of healthy vegetation. So this is something that can be estimated from satellites called Normalized Difference Vegetation Index, or NDVI, which you may have heard of. Tree canopy and satellite data is used to make various estimates, and of course you can also measure distance and amount, percentage or number of public parks and gardens, private gardens, open spaces and forests. So here the methods include GIS or self-reporting, or direct observations, or experientially assigned, and so on. Okay, so examples of health impact assessments with all these in mind of NBS in the US. So again, remember these will be location specific even within the US or within a city itself. In New York City, Central Park, who benefits, who uses it, who sees it as a resource as opposed to a luxury. People may not be able to find the time or the money to travel to Central Park and enjoy it, and so on and so forth. Project program plan, Green Street programs. So I will read again just the top level data. In Tampa, so this was Pew Charitable Trust's report. Tampa EPA Brownfields area-wide plan, again Pew Charitable from 2018. East Side Greenway Project, Trail and Greenway Park. So this was done in Lawrence, Massachusetts, Tampa, Florida, and Cuyahoga County in Ohio. Health outcomes that were anticipated and evaluated included, this is important to read: hospitalization, death rates, cardiovascular and respiratory health, obesity, healthy diet, and cancer. So you can see some are more intuitive than others. So you would say death rates is not so obvious, but cardiovascular diseases and respiratory health, you think providing green spaces enhances physical activities and air quality, so those become obvious. Maybe also relate to obesity, but relations to healthy diet and cancer can be more indirect, but they were anticipated and evaluated in this study anyway. Respiratory health, health-related illnesses, physical health, so physical activity, obesity, diabetes, which we talked about here, premature mortality, transportation, physical activity, and safety. Okay, so we have talked about this in previous chapters as well. Doing cost-benefit analysis in such situations is tricky because benefits accrue over time and may be delayed compared to the investment, and the outcomes are sometimes discursive, descriptive, and not measurable, like well-being or the impact of NBS on cancer and so on, because there are many confounding factors that may be involved which have to be removed. Sorry for the quality of this figure here, but this is the qualitative summary of evidence for nature and health associations. So you have low evidence, low to moderate, moderate, and high evidence. So you have low evidence for cancer, mortality, specific causes, respiratory disease, Alzheimer's disease, and dementia. You have low to moderate evidence for cardiovascular disease, cerebrovascular disease, cognitive function, pregnancy, and birth outcomes. All-cause mortality has a moderate evidence for NBS being a positive impact in terms of reducing all-cause mortality. Okay, no strong high evidence for any health outcome. Looking at model for temporal influence of NBS on health, so you have short-term, moderate-term, and long-term. So here monitoring, evaluation, and cost-benefit analysis is tricky, but often very essential. And again, who will invest based on such immeasurable market goods and health benefits, well-being benefits, depends on cultural values, and of course whether it's a low-income city, medium-income city, high-income city, small size, medium size, large size, and so on and so forth. So here is NBS in the short term: interaction with nature, wildlife, and people, noise, traffic, social determinants of health. In the moderate term, you have stress, mood, fatigue, behavior, exposure, and preference, leading also to benefits in terms of infection, injury, and exacerbation. Infection and injury exacerbation. Habit, chronic exposure, psychological health indicators, physiological health indicators, mental health, physical health. In the long term, you have impacts on morbidity, mortality, longevity, and resilience, which is what we are going for. Resilience of the urban living spaces to extreme events, heat waves, heavy rainfalls, and so on. Cold waves as well. Model for direction of influence of NBS on time, use, resilience, and health outcomes. I want to read everything, but you have positive impacts, negative impacts, and positive or negative when it is dashed line. So you have NBS feeding positively into time in natural setting, engaging with vegetation, wildlife, and in associated social and physical activities, but has a negative impact on time in hazardous settings, so it's a good thing. And associated exposure to air pollution is reduced, noise is reduced, exposure and psychosocial stressors are reduced, which can then feed into physical, mental resilience, healthy lifestyle habits and intentions, intact anatomy and homeostasis systems so that maintain equilibrium, social support and coping following stresses, which can then reduce adverse clinical health outcomes from short to long term. These can increase these things, including risk indicators responsive to short-term change, conditions amenable to management and treatment, diseases of long latency and high severity. So you can have positive or negative impact on these things coming from this box here, but this obviously will reduce all these things as well. Okay, so this is a good loop. This increases this and decreases this, so you can think of this as one loop. So if you have two negative feedbacks, this becomes a good positive feedback. Okay, on the other hand, this also has two negatives and so on. So if you don't know how to do the net feedback, then don't worry about it. Okay, so factors that may affect the impact of nature exposure on health. So effect modifiers. Type of NBS, so views, public parks and gardens, open spaces, trails, private gardens, green spaces, forests, preserves, urban trees, plantings, lakes and rivers, oceans and beaches, wetlands, bioswales, and retention basins that we looked at. Qualities of NBS: shade provided, plant types, area covered, settings, so indoor and outdoor, places for rest and relaxation, places for recreation, accessibility, lighting, opportunities for animals, and for animal observations. Okay, the factors involved here in the middle to translating to health benefits include childhood, midlife, later life periods of exposure. Length and time of exposure can be daily, weekly, monthly. Time of day exposure, months, years of exposure. Mode of travel could be walking, bicycling, exercise, resting, passenger of vehicles, and so on. Individual characteristics, of course, affected by NBS in terms of nature exposure on health: age, gender, race, ethnicity, socioeconomic status, physical health and function, mental health, genetics, health behavior and transportation use. Whether you get to a park by driving your car and looking for parking, or you ride your bicycle, or you take public transportation, and what you can actually afford to do, and so on, all matter in terms of individual characteristics, exploiting health impacts of NBS. In terms of community characteristics, geographic location, so we talked about distance to parks and so on in the previous slide. Social norms, is it okay for women to be out running in the park in some places, or do they have to just walk wearing traditional clothes, and so on. Social cohesion, it's another measure that is another metric that's hard to measure but very important for resilience. Racial and ethnic composition, socioeconomic status, environmental stressors, for example air pollution, traffic, noise, and crime. In terms of socioeconomic or racial and ethnic composition, you know that there was a certain person of a certain color walking around doing bird watching in Central Park, and another person of a certain color complained to the police about it, or let her dog on him or something. It became a big viral kind of news item, and the person who got attacked by the dog and harassed by the person of the other color ended up being greater person, saying he didn't want big litigation and jail time for the other person, and so on. Okay, so maybe I should leave that there and come back and try to wrap it up, because this section is obviously a bit longer. So let's come back and do it in the next podcast. Okay.